Classification of the cephalosporins. In the previous lecture, we discussed about the structure of cephalosporins and the basis for their classification. So, from that, we studied that cephalosporins are classified into five different generations based on their antibacterial spectrum or antibacterial activity. First generation cephalosporins that include oral as well as parenteral. Oral penicillins include cefalexin, cefadroxil, and cephradine. Cephradine also comes with the brand name Velocef that is mostly used. And parenterals include cefazolin. If you look on the spectrum of these cephalosporins, first generation cephalosporins are active against gram positive bacteria and they have limited activity against the gram negative bacteria. So for the gram positive bacteria, it includes Staphylococci and Streptococci. I have mentioned here those bacteria along with the diseases they cause. Staphylococcus mainly cause the skin infections that includes blisters, abscess, cellulitis, folliculitis, and more serious infections. And others include osteomyelitis. These include bone infections, septic arthritis, endocarditis, pneumonia, and bacteremia. Streptococci, that is the gram positive bacteria, it includes two bacteria. Streptococcus pyogenes, that causes pharyngitis, throat infections, impetigo, skin infection, and scarlet fever. While Streptococcus agalactiae, that causes neonatal infections, including meningitis, sepsis, and pneumonia. Then we have the second generation cephalosporins, and these includes oral cefuroxime, cefaclor, and cefprozil. While in the parenteral, it includes cefotetan, cefuroxime, cefoxitin, and cefamendol. If we look on the spectrum of the second generation cephalosporins, they are more active against the gram negative bacteria than the gram positive bacteria. First generation cephalosporins have activity against the gram positive but limited activity against the gram negative. While second generation cephalosporins have good activity against the gram negative bacteria as well. And the bacteria, those includes are E. coli, that causes gastroenteritis, traveler's disease, urinary tract infections, bacteremia, and sepsis. Then another species, that is the Klebsiella species, that also causes severe problems that includes pneumonia, urinary tract infections, meningitis, and sepsis. Then we have another bacteria, that is the Proteus mirabilis, that causes urinary tract infections, which are complicated type, wound infections, prostatitis, and urethritis. Second generation cephalosporins are also active against Haemophilus influenza, that is a gram negative bacteria, which cause many disorders that includes otitis media, ear infections, bronchitis, pneumonia, meningitis, and bacteremia. Then we have third generation cephalosporins. These includes oral as well as parenteral. In the oral, cefixime, cefpodoxime proxetil, and cefdinir. While in the parenteral, we have cefotaxime, ceftriaxone, ceftazidime, and cefaparazone, which can be administered through IV or intramuscular route. If we look on the spectrum of the third generation cephalosporin antibiotics, they have somewhat more spectrum of the activity than the second generation and first generation. And the bacteria against which they work, these includes Pseudomonas aeruginosa. We have already discussed about the Pseudomonas aeruginosa in the penicillin antibiotics, that we have the extended penicillins which can actively work against Pseudomonas aeruginosa. While we have the third generation cephalosporins which are working against the Pseudomonas aeruginosa. And the diseases caused by Pseudomonas aeruginosa include pneumonia, bloodstream infections, urinary tract infections, skin infections, air infections, eye infections, and wound infections. Especially it causes green pus formation in the skin. So we have the another option for the treatment of the pseudomonas aeruginosa. These includes third generation antibiotics. Then they are also against Neisseria gonorrhea. Neisseria gonorrhea, that is gram-negative bacteria that causes the gonorrhea. Gonorrhea is a severe sexual transmitted infection that is characterized by the painful urination, genital discharge, and pelvic pain. So, Neisseria gonorrhea is treated by third generation cephalosporins. Then it is also active against the salmonella, that is the gram-negative bacteria. And salmonella also causes severe disorders that includes gastroenteritis, characterized by the diarrhea, vomiting, abdominal cramps, and a typhoid fever that is caused by the salmonella typhi with a prolonged fever, abdominal pain, and hepatomegaly. It also causes bacteremia and septicemia. Then we have Serratia species. They are also active against the Serratia species. And the diseases caused by Serratia species include opportunistic infections, including UTI, respiratory tract infections, wound infections, and bloodstream infections. Then they are also active against the bacteroids, which are also gram-negative bacteria. And the diseases caused by bacteroids includes anaerobic infections, including intra-abdominal abscess, pelvic inflammatory disease, bacterial vaginosis, soft tissue infections, bacteremia, and abscess following the surgery or trauma. Fourth generation and fifth generation cephalosporins contains only the antibiotics, only the drug substances which can be given parenterally. And these includes in the fourth generation cefepime and cefpyrone. If we talk on the spectrum of fourth generation, they have antibacterial activity similar to the third generation cephalosporins, and they have improved ability to penetrate the outer membrane of the gram-negative bacteria due to their reservoir ionic nature and additional chemical groups enhancing their activity against the resistant strains. So if we explain it, fourth generation antibiotics have same spectrum as compared to third, but they have improved permeability through the gram-negative bacteria. Hence, it make them useful for the resistant strains. Then we have fifth generation cephalosporins. These includes ceftobiprole and ceftaroline. If we talk on the spectrum of the fifth generation cephalosporins, are known as advanced cephalosporin antibiotics, and they are especially reserved to treat MRSA, methicillin resistant Staphylococcus aureus. As in the previous chapter in the penicillins, I discussed that MRSA is a very dangerous bacteria for which no penicillins are active, and we use vancomycin for the treatment of the MRSA. But in the cephalosporins, we have the fifth generation antibiotics that are active against the MRSA. They maintain broad spectrum activity against both gram-positive cocci and gram-negative bacteria. Means they have action on the both gram-positive as well as the gram-negative. These antibiotics are considered the most advanced generations of cephalosporins, reserved for serious and resistant infections like MRSA-related infections, complicated skin and soft tissue infections, and community-acquired pneumonia. Their use is typically restricted to limit the development of bacterial resistance. They are not normally used, but they are used in special conditions where treatment for the MRSA or complicated skin soft tissue infections or for the community acquired pneumonia is going to be treated.